Yeah, I think that we're all hearing about this now, and I think what it brings up is all the echoes of our experience with COVID. At this point, I don't think we need to have a lot of concern. We can have a lot of interest, but I don't think we need a lot of concern around our health and our potential exposure to hantavirus. This is a really interesting virus, but a pretty rare virus that is really endemic to desert regions, and we know this came from rodent exposure in southern Argentina. That's the primary exposure, but this specific substrain of Andes virus can be transmitted from person to person. Initially, the exposure is to rodent droppings or urine. The initial presentation is shortness of breath, cough, fever, chills, abdominal pain, which are very similar to other viruses that people can develop. So sometimes can be missed. And that's what happened on this cruise ship. Untreated, without any access to medical care, we know this carries a high degree of mortality, and 30 to 40% of people may die. If we know about it, getting people to timely medical care and timely critical care has a high degree of survival. So I think that the goal now is to really understand the people that have been exposed on the ship, do complex contact tracing across the world, really, to understand the people that have returned to the United States, who are now quarantined at our National Quarantine Center, CDC Center in Nebraska, and follow their symptoms. Following clearance, they'll be returned back home to continue follow-up. I don't think this is a time in which we have to worry. I don't think we have to change any of our practices or worry about this spreading. The difference with hantavirus is that while there's an initial exposure to a rodent, subsequent exposure happens between people, but very different than COVID. This is the kind of exposure that is probably much more limited to a symptomatic individual and not an asymptomatic individual or someone that has no symptoms. One of the interesting things about COVID was that you could be asymptomatic and be shedding the virus, and that is not the case as far as we know with hantavirus. So at this point, I think we should all stay tuned. This is not a time to panic or be overly concerned. I think we can continue going to school and shopping and traveling by air. I think we take the normal precautions that when we're sick, we should wear a mask. We should all be doing good hand hygiene and just being thoughtful about how we approach things. But at this point, I think we're all safe. We're going to hear a lot more, and we're more than happy to provide more answers and more insights here at Dartmouth Health.